The CDC says over half of the states in the country are reporting very high or high levels of flu-like activity as we head into the holiday. Many hospitals are also facing a rise in RSV cases as COVID-19 continues to spread as well. ABC News contributor and Chief Innovation Officer at Boston Children's Hospital, Dr. John Brownstein, joins me now for more on this so-called perfect storm and what to do about it. Dr. Brownstein, I didn't use triple-demic because I know you're not a fan of that term. But talk me through this. With this rise in RSV cases that we've been reporting on for a while now, and now the flu too, first of all, are there particular age groups we need to worry about?
Yeah, good morning, Diane. This is a real concern for our most vulnerable. Just like we've been talking about for COVID, it is those that are the youngest, newborns and infants, and then those that are older, 65 and older, those with chronic conditions, chronic heart disease, lung disease, weakened immune systems. Those are our vulnerable populations. And I know we talked a lot about RSV in our kids, but also it does occur in adults. And we see tens of thousands of hospitalizations, thousands of deaths due to RSV each year in adult populations. And we're seeing those numbers rise dramatically. We're higher than we have been for this time of year over the last 9 years. And so while most people deal with RSV no problem, it's cold-like symptoms, some can develop these severe lung infections and pneumonia. So you're worried about those with asthma, pulmonary disease, heart failure. Those are the kinds of people with chronic conditions that we have to worry about this holiday season.
Now, Thanksgiving is Thursday. Many of us will be gathering with our families. Do we need to take special precautions, and are there things we can do short of masking or social distancing?
No, right, Diane. Everyone is tired of a pandemic, but at the same time, we've learned a lot from the pandemic playbook that we can bring into play. Yes, people are tired of masking, but you want to plan around your most vulnerable participants in your Thanksgiving. Those are newborns, elderly, immunocompromised, and plan around that. So if you're symptomatic, stay home. If you've had some exposure to virus, be thoughtful about whether you want to attend to that event. Test for COVID. We don't have other tests at home for the other viruses, but at least you can test for COVID. You can have good ventilation, open up that window crack to have air circulating. And then, of course, we have vaccines. We have the bivalent booster. Everybody should be up to date. We have a flu shot. We don't have the RSV vaccine yet. But for those that you can get protected, do so. And, we can really help protect our hospitals from being strained post-Thanksgiving.
What about after Thanksgiving? There were fears of a COVID surge these past couple of years. Are you worried this year about what happens as people come from those family gatherings and return to the office, for example, or school?
Yeah, well, Diane, you've hit the nail on the head. I've actually published on this exact topic, which is Thanksgiving, unfortunately, is a super spreader event. People travel, they congregate, they mix viruses, and those people return home. Unfortunately, that is a big ignition of flu and potentially a new COVID variant. So I am worried about that. So, of course, people returning, try to get tested. Make sure to stay home if you're sick. Don't bring that virus into the workplace if possible. But I am worried that things are going to get slightly worse after Thanksgiving. So we're in for a little bit of a rocky ride, especially for our hospitals now that are already dealing with these capacity constraints.
Do you think it would help, this is really quick because I know I'm out of time, but do you think it would help for companies that have the ability to have workers work from home for a few days after these holidays?
It's a really smart idea, and it is something that, that has been, experimented with. I do actually think that it's reasonable to give a couple-day buffer if possible. Most people obviously are not in a position to be able to do this, but for those who are, to give a little time to make sure that you've cleared out any infection, that you're not transmitting virus in the workplace, I absolutely think it would be a very innovative policy.
All right, Dr. John Brownstein, we appreciate it as always. Thank you, and a happy Thanksgiving to you if I don't talk to you before then.
You too, Diane. Thanks so much. You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.